pace yourself and prepare for stressors, knowing that stress can exacerbate pain. Okay, and then relaxation and neuromodulatory treatment. So these are treatments that focus on teaching self-regulation of physiological processes. So this works a lot with that autonomic nervous system. It's really calming down your body, sending your body calm, safe messages instead of danger messages. Relaxation training with or without biofeedback can be effective. Mindfulness meditation is getting a lot more attention in the literature. Different studies looking at brain activity find that during mindfulness meditation, there's less activation of the thalamus in the brain, which is kind of the first stage of the pain processes. So that's really interesting that they're showing that's actually calming it down. And there's other research showing that the system that mindfulness is working on is even different than the opioid system. So it can maybe serve an additive effect to medication. And then Dr. Seltzer is looking at, her team just finished a hypnosis study. So looking at hypnosis in patients with sickle cell, and hypnosis gets a bad rap often from magicians and entertainment and things like that. But clinical hypnosis is actually, it's a state of focused concentration, focused attention, where the patient or the person you're working with is in control the whole time, and they're kind of leading the hypnosis. Ultimately, it's self-hypnosis. And they do a lot of work with this in pain and find some really good effects. Studies have supported that this can reduce pain. And also looking at, it can also change blood flow. They've shown that while someone is engaging in hypnosis, their fingers are warmer, so that means their blood vessels are more dilated, so it can be helpful with sickle cell disease. Hypnosis works on, they have neuroimaging studies that show that it deactivates all the areas in the brain involved in pain processing. I'm going to go a little quicker here, sorry. So our lab looked at this. This is before I got here, but I'm hoping to continue this study in the future with kids. And they wanted to see if it increased blood flow in patients with sickle cell in just one lab session, 20-minute lab session of hypnosis. And they wanted to compare that to people without sickle cell. So this is just what happened, what they went through. So they had a little, to do the pain testing and test the pain tolerance, they had a thermal device that had warm pulses on the arm, and they used a pulse ox to measure blood flow. And so pain threshold higher is better. So in the controls, they saw a significant improvement. In patients with sickle cell, they showed an improvement, not significant. This is a very small sample size. Pain tolerance, higher is better. Again, we saw increases across both groups, a significant increase in controls. And then similar sensitivity went down for both groups. So this is cool. So in the patients with sickle cell, they saw increased blood flow, which means vasodilation. So this is a really cool outcome just after one session of hypnosis. So this is promising in this small sample size. Okay, so future directions for this study, we want to look at this in adolescents, really trying to prevent this repetitive damage and try and train patients earlier to kind of help them learn how to relax, help them to activate their parasympathetic nervous system as opposed to their sympathetic nervous system, and look at the effects of social stressors on this treatment response. So just some take-home messages: all pain is real. Pain should be treated in the context of the person. Treat the person in pain, treat the person with the disease, not the disease just itself. Address emotional, social, family factors, involve a interdisciplinary team, and possibly involve mindfulness, hypnosis, things like that might be helpful. Just some images here. Also, I don't know if you guys know about the Voice Crisis Alert app. It helps track pain, and it can be helpful. And that's it. Okay, thank you.
So rounding off our morning phenomenal presenters, Again, happy to meet another cultural ally at work, Dr. Gretchen Badami. So we talked about complementary alternative pain management.
Yeah. Thank you. PowerPoint gets up here. Thank you, and I know we're running a little bit behind, so I'm going to try to talk fast. Just to give you a brief background on myself, I'm a doctor of acupuncture and Oriental medicine. I practice herbal medicine, acupuncture, meditation, mindfulness, diet and nutrition, and lifestyle changes to affect people's health, both chronic, long-term, acute, and we practice looking at the whole person. Okay, great.
Close the bar there. There you go.
I also I am one of the deans at a college for acupuncture and Oriental medicine, and I teach in the herbal medicine department. And at our college, we have a clinic, which is a low-cost clinic for patients to receive treatments in acupuncture, herbal medicine, diet and lifestyle. And one of the main symptoms which we treat for our patients, one of the chief complaints that people come in with is pain. I would say that that's the number one thing that we are treating in our clinic. Secondarily, we treat a lot of psycho-emotional imbalances and distress, so depression, anxiety, sadness, grieving. And third, we treat a lot of chronic disease and internal organ imbalances. So when we look at what a patient with sickle cell disease is experiencing, we see all of those various things during the progression of your life and your disease. You have acute pain crises. You have chronic disease and disorders that develop throughout your lifetime, and then the psycho-emotional effects and traumas that you go through.
I'm sorry, what's your name?
My name is Gretchen Badami.
Gretchen. Thank you.
So, treating pain with natural medicine, utilizing multiple modalities. I'm going to just talk on a very superficial level today to give you some introductions to the different modalities which you can utilize to augment the treatments that you're already receiving through your Western medicine treatment. So there's my introduction there. What is Oriental medicine and natural medicine? I happen to be a doctor of Oriental medicine. That's the main modality that I use is acupuncture and herbs and nutrition. But I'm speaking today in general about natural medicine. But Oriental medicine, as well as holistic and traditional medical systems, have been practiced throughout millennia in traditional cultures. If we look at Asia, if we look at Africa, Central America, South America, Native Americans, Central Europe. Oriental medicine has been around for about 2,000 years as we know it, documented with research, with texts and empirical studies to develop modalities such as acupuncture and herbal medicine. Traditional cultures did not have labs and blood work and MRIs and all of these modalities that we use now to diagnose disease. They had to identify a patient's imbalances based on functional organ systems, based on symptoms, and based on taking a thorough intake and history and looking at each individual as a comprehensive and individual human being. So if I have 5 people come into my office in one day with pain, they may all have neuropathic pain, but I'm going to give them a thorough intake and find out when did that pain start? What is the nature of that pain? Is it sharp? Is it distending? Is it fixed? Is it moving? What part of the body is it in? And I may make 5 different diagnoses for those 5 different patients, even though they may all come into me and say they have pain, because each person is an individual. And that buildup of that pain over the course of their lives and based on their history and based on their individual characteristics and constitutions is going to be different for each person. And so I'll choose to treat them with different acupuncture points, different herbs, and different diet and lifestyle suggestions. Let's see. So who practices holistic and integrative medicine? You have various doctors who you can go to for these sorts of assessments and treatments. You have naturopathic doctors, NDs, they use herbs, diet, nutrition, vitamins and supplements, and lifestyle recommendations. You have osteopathic doctors who have a similar education to medical doctors, but they utilize more hands-on techniques for alleviating pain, as well as modern and natural methods of disease prevention and whole being enhancement. We have doctors of Oriental medicine and licensed acupuncturists, of which I fall into that category, where we utilize integrative medicine, and we use acupuncture and herbal medicine, diet, lifestyle, supplementation, and energy medicine. And then you have chiropractors who do body work and adjustments in addition to supplements. So why would someone want to augment their medical care that they're currently receiving with holistic, integrative, natural medicines? Well, there's a lot of reasons. Holistic medicine treats not only the symptom, which we would call the branch, but it treats the root of your disease. So we not only want to alleviate your symptoms when you come into our office with your pain, but we want to look at why is this happening, what internal imbalances are going on in your body, and how can we start to bring your body back to a state of homeostasis so that you have less frequency of pain crises, so that your immunity can become strengthened, so that you have less opportunistic infections, so that you have to go into the hospital less, so that you may have to be less dependent on medications, which may have side effects. And so that over the course of your life, your organs and your whole health can remain stronger, longer, even though you may have been diagnosed with a genetic disorder. And looking at sickle cell disease, holistic medicine, diet and nutrition, and acupuncture and meditation and movement are effective in treating pain and symptom management, as well as strengthening, as I said, your immune system, improving the oxygenation of the blood in your body, and decreasing the number of sickled cells, which you have, even if you are diagnosed with sickle cell disease. So how does holistic and integrative medicine view sickle cell? We have a lot of strange sounding diagnoses in Oriental medicine. We talk about kidneys and liver and lungs, and some of these diagnoses are similar to your Western medical diagnoses, and some of them are very different. But when we look at someone with sickle cell, we look at strengthening their kidneys, and we talk about the kidneys as the root energy provider in your body. So your kidneys are, when you're born, your kidneys provide your DNA, your genetic code, and they provide what's called your jing, your essence in your body, which keeps you strong throughout your lifetime. If your kidney system is weaker, you may be more prone to genetic disorders, and you may have a weaker constitution in general. We look to strengthen the blood and the organ systems that are associated with circulation. So in Chinese medicine, in Oriental medicine, in natural medicine, we talk about the liver detoxifying the blood and circulating the blood. We talk about the heart circulating the blood. We talk about the spleen system and the digestive system actually producing the blood. So what does that mean? What you eat, what your lifestyle is, what the nutrients that you take into your body, and the oxygen and the nutrients actually create your energy in your body, which helps your immunity and helps you fight off disease. So we look to strengthen the body's root systems by strengthening all of these organ systems, in addition to symptomatically treating you when you come in with pain. So what treatment methods are utilized by Oriental medicine and natural medicine? Well, I talk a lot about acupuncture. That's one of the primary modalities that I use. How many people in here have ever heard of acupuncture? Okay, it's become pretty popular these days in mainstream. How many people have ever tried acupuncture? Oh, great. Okay, that's more than I thought. So acupuncture uses single-use stainless steel, sterile, disposable needles to trigger the body's internal mechanisms to come to a state of homeostasis. There's nothing injected into the needles. How does it work? Well, Chinese medicine believes that we have qi, or energy, flowing throughout our body in certain rhythms called meridians. These are certain patterns. And so by strengthening your qi and moving your qi, we can help to alleviate pain and strengthen your system. This might be something that you have to just suspend your belief to say, well, do I believe in qi? Do I believe in these meridians? No longer do you need to do that. Through modern medicine and through the technology that we have at our disposal in the past 10 to 20 years, we've been able to now have enough research studies and enough science utilized for our medicine to actually prove why acupuncture is working. So acupuncture taps into something called the HPA axis, the hypothalamic pituitary axis in your brain. That particular axis is in charge of your sympathetic and your parasympathetic nervous system, keeping the homeostasis in your nervous system regulated. It also helps to regulate your endocrine system and your hormones in your body, and your endorphins, your dopamine, your serotonin. We're learning that all of those different aspects in your body, which are controlled by your brain, are what modulates pain. The pain receptors in your body, your experience of pain, the well-being that you feel in your life, your emotional balance, as well as the physical functioning of the organ systems within your body. So lo and behold, not only does acupuncture just get, do the needles just get stuck into your muscles, which provides muscle relief. Sometimes it provides some muscle twitches. There's something called trigger points and motor points that help to relieve your muscles. But acupuncture does so much more to regulate your internal system and your pain mechanisms and your experience of pain in your body. And this is only something that science has been able to prove to us within the past 20 years. So no longer do you need to think that acupuncture is a belief system or a religion or some sort of hokey, mysterious modality. So I have a couple of studies here, and I'll go through them very quickly because I only have about 5 minutes. But there are a lot of studies that you can Google on PubMed and do some research into. A lot of them are very small, and unfortunately there's not a lot of funding for our medicine in America. So I didn't bother bringing in any of the small studies today, but there are a few very large ones. This one in particular was done in Nigeria on almost 350 patients. All of them received acupuncture over the course of 10 treatments. And, the disease course for these patients ranged from 4 to 20 years, and the age groups were anywhere from 5 years to 25 years old. Over the course of those treatments that were given, and all of the treatments were postponed during this time, 176% of those patients received significant improvement of joint pain. 93 received general improvement. 67 cases received no change. So the total effectiveness rate for acupuncture on sickle cell patients without medication was 80% pain relief. Tuna, medical massage, this is another modality which you can get done. Massage in general is very good, as you know, for your circulation, for moving what we call the chi and the energy in your body. So when you're in pain, when you're having a problem getting oxygen into your blood and the blood moving through your body and your circulation, massage is a wonderful modality, and holistic medical practitioners will do that for you. In terms of resources for receiving acupuncture and medical massage, you can go to a private practitioner. Insurance under Obamacare, starting in 2014, is now required to provide insurance cover on some level for anyone who are receiving insurance under Obamacare. Now, this will vary based on your individual insurance plan. Some people need to have a certain amount of copay covered before they can start receiving benefits. Some people get a certain number of treatments every year or a certain frequency of treatments. Unfortunately, I don't believe that acupuncture is currently covered under Medicaid, and we're actually fighting in our profession to get that covered, because of course people on Medicaid are people who need it the most, right? This is a very low cost of effective treatment that has very few side effects. Other places that you can go as well, though, are community clinics, where you can get community treatments for anywhere from $15 to $20 per session. And also school teaching clinics. Schools like the school that I am a dean at and other schools have very low-cost treatments as well that you can get treated by student interns under the supervision of a licensed practitioner. I only have 3 minutes to talk about the rest of my so herbal nutrition, diet nutrition are very, very important for people with sickle cell. When we talk about giving herbal medicine for pain, herbal medicine is very important to maximize your body's resources to function as optimally as possible. Cutting out processed foods, refined sugars, and refined carbohydrates. These will deplete your body's natural healing resources, make you more prone to infections, and make you less resilient. So by changing your diet and nutrition to have whole foods and natural foods, you can actually strengthen your immune system. And There are many supplements and herbs that you can take, things like ginger, turmeric, capsicum, which is found in chili peppers. All of these spices, which traditional cultures have used in their foods, in their cooking, are now being found to have anti-inflammatory properties, antibiotic properties, and healing properties for your body. So cooking with whole foods at home with real ingredients actually helps to maximize your immunity and your ability to produce healthy cells, oxygenated cells, and non-sickled cells. A whole bunch of vitamins and minerals that I have listed here, but basically the whole slew of vitamins and minerals that you find in fruits and vegetables, A, B, C, D, zinc, magnesium, all of these are important for keeping your red blood cells healthy, as well as omega-3 fatty acids, which we can find in fish oils. There are a number of sickle cell studies with herbal medicine as well, and they are very beneficial in the same way that the acupuncture study was that I just read to you, basically showing that with herbal medicine and conventional medicine used together, herbal medicine along with conventional medicine helps to boost people's health and reduce their frequency of pain crises. So we had a study here that showed that the herbal medicine formula that was given to sickle cell patients in Beijing, 16 out of the 17 patients taking the herbal formula had their symptoms ameliorated. Hepatosplenomegaly, which is basically your liver and your spleen becoming enlarged, right, from the processing of the irregular blood cells, decreased. Healthy hemoglobin significantly was elevated. Pain was decreased, and there's no side effects to this medicine. There was another study, that was done with 28 patients. Again, these aren't as large as I would like them to be. The acupuncture study was much better, but with 28 patients, 20 were controlled with the conventional medicine therapy, and then 16 received conventional Western medical therapy, as well as the herbal formulas. They received 6 months of treatment. The sickle cells reduced in 50% in 11 out of the 16 for the treatment group with the herbs and the conventional therapy, and only 4 out of the 12 in the conventional group. So we have almost a doubled increase in the benefits that you can receive if you utilize both forms of treatment together. Let's go through some things I just said. Lastly, in the last few minutes, movement and meditation. Mindfulness is very important for your sympathetic system in your body being reduced to bring your body into a state of healing and homeostasis. We talk about Tai Chi and Qigong and yoga, but it doesn't even have to be systematic exercises like that. It can simply be stretching, walking, doing some mindfulness and meditation. All of these things will help to increase your circulation in your body and increase the oxygenation of your blood. Meditation has been proven to reduce pain, enhance immunity, reduce anger, anxiety, and depression, increase blood flow and lower blood pressure, and bring you to a healthier heart rate, emotionally provide you with a sense of calm and peace, reverse heart disease, increase energy, and lower stress. Lastly, common sickle cell patient needs, which you're all, I'm sure, aware of already, but opioid pain medication, anti-inflammatories, antibiotics for infections, and oxygenation of your blood. Acupuncture has been now shown to be a very viable option to opiates. And in 1996, the WHO declared acupuncture a suitable replacement or addition to the treatment of addiction. And when we talk about addiction, as Pat was saying earlier, we don't necessarily mean that sickle cell patients are addicted, but nonetheless, if we can reduce the frequency of opioid medications, right, it's a benefit. So acupuncture is inexpensive, simple, no negative side effects, can prevent opiate relapse, and safe for pregnancy, labor, and breastfeeding, which is huge if you're on those medications and you're looking to have a family or you're breastfeeding. We can mediate the sympathetic and parasympathetic pathways, downregulate inflammatory cytokines, inflammatory neuropeptides. So basically we're getting rid of inflammation in the body with a healthy diet and lifestyle and acupuncture. And as we keep your immune system strong and strengthen the body, we can help to prevent infection and prevent opportunistic infections and hospitalizations so that you can rely less on antibiotics.
helping oxygenate your blood, and
I raced through that, that's it.
Thank you. So we have a little gift, I'm told. We're going to allocate 5 minutes to this person to present another important alternative way. Let's take a deep breath and trust that our family is taking care of the person who needs assistance right now. And actually, Ward, would you step out for me, please? Thank you. I'll feel better. And just send a moment of healing hands to those who are with the person who's in distress in this moment. It can allow us to be present here. So I understand we have a special guest with us, F.D. Guyton, who's going to share with us, and I'm so glad you're about to do this, and I'm going to say this. Egyptian reflexology, real-time pain relief. I appreciate the cultural groundedness of the healing practices.
Awesome.
Thank you.
Thank you. We'll keep this brief, but I'm excited and ignited about being here. And what I'd like to do is talk about touch therapy, relief through relaxation with the method of Egyptian reflexology, and I have a table out front where we can kind of get into it a little bit more. But I do know that pain, chronic pain through touch therapy can give you a break. I did a study I'm from Houston, Texas, and there's a sickle cell community out there that I work with real closely. And through touch therapy, I did a study with a gentleman, Darren Tate, who's president of the Crisis Sickle Cell Organization. 6 weeks. When he came to me, he was getting ready to go into crisis. In 15 minutes, he was asleep. And the next day, or the next 3 days, he was out of pain completely, and then he came back. And so we did that for 6 weeks, and we had incredible results. So I have a table outside. I would love to demonstrate and show you some of the techniques through touch therapy that we do. And I also have a topical pain cream that we also recommend, all natural. What you do, you rub it on the pain. In a few minutes, the pain begins to subside. I think we call it depleting the substance P. Yeah, so I'm glad that I'm having the opportunity to share and to be here with you all. So just meet me outside and we'll get a chance to go a little further. Thank you.
Thank you, everyone. What I wanted to do is to share a few brief highlights of what stood out for me as I listened to the panelists, open us up for about at least a few questions, and then make sure we break for some lunch. Do I have?
No.
Okay.
It's not lunch.
Okay.
Sorry, real quick. So our keynote speaker is here.
Okay.
And we'll just take probably a 10-minute break just to get some fresh air, and then we'll do our keynote speaking. And our lunch is at 12:45. So you guys have time to get something to drink and eat. Let's do our summary. We'll have a few minutes to break and move our body. Get some sun, and then we'll come on back.
Thank you. Okay. So here's my brief summary. So I also have to locate my work too as a member of the Association of Black Psychologists. practice, which is grounded in trying to understand what does it mean to be human if we centralize who we are as members of the African diaspora. And so for many times for us the question is not what does it mean to be human, but what does it mean to be spirit-like, because we are spirit-like. That's that fullness for us. So we've always been innately in integration of what Western psychology calls mind, body, spirit was never differentiated in us. So anything that we do, we're fully showing up for. So even the term holistic is a Western term that doesn't fully complete who we completely are, because we believe in the lifeness being those who are here before us, those who have yet to come, and our own connectedness. So as we continue to engage and take in this important information from a Western perspective, we must also always ask ourselves critically, what does it mean for us from a cultural perspective? Because sometimes there's more information, there's another part of a story that still needs to be in place. More specifically, what needs to be in place here too is placing all of this within a social political context, because sickle cell disease is not in isolation here in America. It has a black face to it, so therefore it is embedded in systems of oppression and racism, known and unknown, and intentionally and unintentionally, consciously and unconsciously. So what I also want to share as I listen to this is empowering our folks to always ask, so what does this have to do with me? So I appreciate our complementary alternative approaches, but we're our cultural grounded ones from an African perspective, because we do have a lot of healers. And as a dean and as another dean to a dean, how do you have to go and look for that information, because within our capitalistic society of the United States, there's privileging of what information hits a study and what doesn't. So you have a wealth of psychology, black psychology, where it's been sitting there for hundreds of years that doesn't get tapped into when it's time for us to do these studies. So we as psychosocial team, we have to dig and go out and unearth that and bring it forward and place it side by side. There's comedic yoga, for example, which is a culturally centered yoga. So as we're talking about this, this is the other level of consciousness, because many times persons of African ancestors have forgotten what they used to know too.
Right.
So this is an enlightenment, a conscious to move forward. We think about issues of meditation and hypnosis. In many of our spiritual communities, they're hesitant to tap into. It doesn't feel spiritual for them. So as psychosocial presenters, we have to know that context too. And what I then say to my spiritual leaders is, this is just a new name for what we've been doing for centuries. Okay, it's repackaging so that Western psychology can understand it. But we got to speak to our spirit. We've been speaking in tongue. We have been feeling the spirits. We have had altered sense of consciousness since before time. Since before Oriental medicine. Oriental medicine has its roots in our Egyptian history. So we have to really stretch and do this. We have to bring it forward. Remember this. Also, we hearing the similarities of our human experience is always questioned and dehumanized in the United States. We're prone to it in our healthcare as well too. So how do we work with our healthcare providers and say, can you help me understand what does this have to do with systems of oppression? Bring the question forward, because then a good intended provider will go, you know, that's a damn, I don't know if myself, let me go figure that out. Because they're not thinking that, they're not seeing it in the moment. So we have to bring that forward as well. My other points I'm going to close with too is this idea, I appreciate the talk in terms of what happens to our bodies or to people who live with sickle cell disease, but this issue of fight and flight is part of complex trauma. We have to look at it as well too, because people who are targeted, who are part of a targeted community, either directly or indirectly, every time an assault happens in our community, we feel it in our heart, even though I don't know that person. Right? So that means we're constantly in fight and flight. So if our healthcare provider is not taking that into consideration, they're trying to understand the pain that you're experiencing at that moment, then they're missing a huge context. So you could be giving relief in the moment, but the historical, the bigger complex is not being taken care of. And when we look at our studies abroad, like with Beijing and whatnot, that was with those who identify as Asian with sickle cell disease. We'd be very explicit about that. So as our community sees this, they can see that was in Beijing, Chinese Asian people diagnosed with sickle cell disease, which is going to be related but different for Africans in America living with sickle cell disease. Just to kind of make sure both are in place to kind of foster the criticalness. And I'm going to close with this one. I'm really getting here. So I also want to say too, because I don't want us to assume that sickle cell disease is the problem. Right? It's a manifestation of a number of problems. Okay? And anyone who's working with us has to engage us in that capacity. They don't have to have the answer, but they need to appreciate the complexities of that. The sickle cell disease is a manifestation of many problems that we have that needs multiple efforts. So again, in closing, I just want to applaud our colleagues who've come forward, applaud you guys for being here today, but those are just some of the things that should have stood out for me. I appreciate hearing the understandings of the complexity, but just wanting to push the envelope a little bit further from a social justice perspective and help hold your healthcare providers accountable to you. Make us better than who we are. Push us. Ask those big questions. Okay? Because that'll make us do that work, bring stuff forward. Because if we know that sickle cell disease existed before we named it, treatment existed before we named it. So let's go back to when and find out how our mothers and fathers on the continent treated it. And just because we don't have it as evidence-based yet doesn't mean it doesn't help. Because not everything that's evidence-based is the best for us. And many things that are practice-based are much more effective. We have to be able to have both sitting side by side. Thank you.
Thank you.
So everyone, we're going to take a break. We're going to begin promptly at 11:45.